Good day, everyone. My name is Jan Aniverosalejos, and we, together with my fellow reporters, Miss Sheena Angel Inso, Miss Natalie Bachansila, and Miss Maika Magallanes, will be discussing to you the Republic Act of 9165, or better known as the Provision of Comprehensive Dangerous Drug Act of 2002. What is the Republic Act of 9165? The Republic Act 9165 is an act instituting the Comprehensive Dangerous Drugs Act of 2002, repealing Republic Act Number 6425, otherwise known as the Dangerous Drugs Act of 1972, as amended, providing funds and for other purposes. The Act provides sections on importation of dangerous drugs and controlled precursors and essential chemicals. It establishes offenses and penalty according to the different dangerous drug, regardless of the quantity and purity involved. The Act also expounds in what certain scenarios are to be conducted if the provisions under this Act are to be violated. There are also protocols in administering these drugs for the sake of safe use. This could also mean that for every pharmacist dealing in dangerous drugs and or controlled precursors and essential chemicals shall maintain and keep an original record of sales, purchases, acquisition, and deliveries of dangerous drugs, indicating specific information thereof limiting these uses. But what is truly the meaning of drugs?
A drug is a medicine or other substance which has a physiological effect when ingested or otherwise introduced into the body. They were taken either orally or injecting as long as it enters the bloodstream of a patient. Nowadays, the term drug has a vast meaning, which gave a lot of different definition that is needed to have context. While taking medical drugs are good for your health, taking it moderately should be prescribed, as always, because they still have their side effects that can be harmful to the person. Drugs should be taken in its prescribed dosage, which leads to why people experience fatigue in taking drugs as well as intensify or dull their senses, change how alert or sleepy they feel. Why do people turn to drugs? For most people, drugs are considered as a way of altering consciousness that is not so different from many other recreational activities. However, for the relatively small number of people who develop more compulsive drug-using patterns, drug use is not just about having fun, relaxing, or for partying. It usually serves a deeper purpose, such as helping enhance identity, acceptance, and reducing physiological distress or a sense of alienation. Human beings have a long history of using substances to alter their consciousness. Ancient tribes made their own mind-altering substances, some of which are still used today. If you have become dependent on a drug, you could end up in financial trouble. With frequent use of drugs, this turns people to do drug abuse.
What is drug abuse? Drug abuse is when a person is in use of prescription or over-the-counter drugs for purposes other than those for which they are meant to be used or in excessive amounts. These drugs can no longer be called as medicine, as its properties can cause severe disorders and illnesses that are deemed incurable or hard to cure. This, however, does not only limit to medicine, as there are drugs under this category that are exploited, such as stimulants, inhalants, cannabinoids, depressants, opioids, steroids, hallucinogens, and prescription drugs. Drugs from these categories can impair a person's central nervous system and their ability to safely maneuver on their daily musings. What are the two types of drugs? There are two types of drugs that can be used improperly, resulting into a chain of reaction of abuses, such as illegal substances abuse, which refers to the abuse of illegal substances like marijuana, heroin, cocaine, or methamphetamine. There is also legal substance abuse, which are also in the rise, such as alcohol, nicotine, or prescription medicines. Alcohol is the most common legal drug of abuse, which lead us to the conclusion of both types of abuses eventually leads to diseases, chronic illnesses, and mental disorders. The use of illegal drugs or the drug abuse may lead to social, physical, emotional that may relate to job-related problems. Drugs can also be in use to cope with problems in either social, physical, and emotional that are dealt with within the use of these drugs. But what does that make the person of? They can be called as drug abusers, which lead to our second section. People who are in use of these drugs are called drug abusers, which lead us to the question of what are the characteristics of a drug abuser.
What is a drug abuser? A drug abuser is a person who increases his or her drug use in multiples over time. A drug-dependent person experiences mood swings, which inevitably change a person's physical, emotional, and mental well-being. Within that state, a person's judgment and insight are also impaired as they consume these harmful substances. How to tell if someone is a drug abuser? Some of the most telling signs of chronic drug use are physical changes to the body, both externally and internally. Physical change. Behavioral change. If a person is abusing any drug, there are some of the general signs to look for.
Drugs have the potential to ruin your life. They may have an impact on your family and friends. There is a greater chance of harm and or assault to yourself and others. Many drugs are illegal, and possessing them can result in a fine or imprisonment. If you're convicted of a drug crime, you'll have a criminal record which can make it difficult to find work, receive a loan, or even travel internationally. But most noticeably, it can make your life miserable.